Well, deaths from accidental drug overdoses surpassed murders in New Orleans last year. Officials blame it on an increase in opioid abuse. Some doctors say it's time for them to start monitoring prescriptions and to eliminate stigmas to keep the community healthy. Dr. Brent Wallis from People's Health is here with more on that. Thanks so much for joining us.
Certainly.
I mean, this has become an epidemic, hasn't it?
It's terrible, yes. And we're actually seeing a huge increase in opiate deaths. Really in 2016, I think you've heard the reports that our opioid overdoses surpassed murders in Orleans Parish.
All right, so what, for people who don't know, if you lived under a rock, because it's everywhere, what are opioids?
So opioids are very powerful painkillers, and they're prescription drugs that are mostly prescribed by primary care physicians. In fact, over 50% of the scripts are by primary care physicians and the rest are by specialists.
And really, some people may think, well, my doctor prescribed this medicine for me, so it can't be all bad. And they don't realize that it's extremely addictive.
Right. And if used correctly and for the appropriate amount of time, they can be useful medications. I think one of the problems that we see is that the number of pills that are dispensed is way exceeding what is necessary for the types of pain that the patients have.
And that's the new effort now for doctors to just prescribe just a limited amount of dosage.
Right. The legislature has actually passed some bills that are moving towards reducing the number of days supply to 5 or 7.
Okay, we're talking about OxyContin, Percocet, codeine, hydrocodone, fentanyl. So if you hear that being prescribed to you, it should be a warning sign, right?
Definitely.
All right, what if you're concerned about a loved one who is taking these medications and needed it for severe pain, but you see some changes in them? When should a red flag go up and say this person has a problem?
So the biggest thing you want to watch for is any signs of dependence. So dependence is actually a medical condition that should be treated by a doctor, and it needs to be identified and diagnosed just like diabetes or heart disease. So some of the things you would watch for is where the dose of medication that you're taking no longer works, so you start to escalate the dose, or you start not doing things that you used to enjoy because you're trying to get your medication or you don't have your medication.
You try to get them some help if they're rejecting help, which some people normally do. I mean, it's just like a catch-22. What do you do?
I mean, the most important thing for the family members, or if it's you yourself, you should do is speak to your physician about it. Louisiana also has an alcohol and drug helpline that you can call to see where you can find some help as well.
Yes. Dr. Brent Wallis, thank you so much for joining us.
Thank you.